Hey guys, it's Dr. Cameron Dennis, a physical therapist with Back on Track Therapy and Wellness. And I'm doing a knee series in my running injury support group, which includes, the series itself includes I'm discussing the anatomy today. And then later this week, I'll be discussing the issues that can occur with the knee with running and lifting. And then I'll be discussing, hi Susan, some fixes and some possible ways to correct a lot of the knee pain that people experience with running. So without further ado, I'm going to turn the camera around. Now, I don't have a cool program to do the anatomy like some other people do. I'm looking at you, Brianne. But I have my computer pulled up here, and I'm going to show you kind of some of the anatomy of the knee. So, and I understand this isn't for everybody, so don't feel like you have to watch if you're not interested in the knee. But many of my runners have been asking about this. So basically what we have here, this is the front of the knee. As you see here, this is kind of where the femur is. This is the tibia right here, and the fibula. Okay, so the tibia is the main bone of the lower leg, the femur, obviously the big bone, the long bone, and the top of the leg. And the fibula down here is important for a lot of muscle attachments and things like that. So it's not a weight-bearing bone like the tibia is. So, however, lots of muscles and tendons attached to that. So you'll actually see there's an aponeurosis, we call it. It's just basically ligaments that attach the fibula and the tibia together. And you can actually feel some of these structures here. So you can actually feel the front of the tibia right there, kind of protruding. So what you have here is the patellar tendon, which is actually more of a ligament because it attaches the patella to the front of the tibia when tendons typically attach muscle to bone. So that's the patellar tendon. You hear about that one quite a lot with runners. The same as the quadriceps tendon, which is right here, attaching the various muscles of the quadriceps to the patella. Okay, so you also notice these structures. There's one here and one on the opposite side here. Those are the epicondyles of the femur. Basically, a lot of the weight goes through those here on the tibial plateau, and there's a little gap in between, which you can kind of see a little better over here. There's a little gap in between here, which allows the patella to go up and down when you flex and extend your knee. So you'll notice this white stuff here, okay, on the top. That's cartilage, okay, articular cartilage they call it. Just means that it basically is articulating or rubbing against the articular cartilage. Down here, what you actually have in the knee joint is meniscus. So you have your medial meniscus and your lateral meniscus. Okay, the medial meniscus is actually attached to the MCL. There's your LCL, the ACL right there, which you hear about all the time, and the PCL. Okay, so basically those are going to be ligaments that hold the knee together. They prevent the bones of the knee from separating with various motions. So there, obviously, that's the patella. Let's see. Let me go across here. What we have here, and you can't really talk about the anatomy of the knee without talking about the anatomy of the hip as well, because so many of the muscles actually attach. Okay, so actually let me use my cool little mouse here. So what you have here, this is the glutes, the glute max, glute med. Here is the iliac crest, which is part of the pelvis. Okay, that's like the bowl aspect of the pelvis. Your TFL, or tensor fasciolata, is a hip abductor. This is your IT band, which runners talk about all the time, and you'll hear about that all the time when you go into these running groups, and everyone seems to be having trouble with the IT band, or at least it's blamed for a lot of the troubles that we're having. So what else can we talk about? Here's the posterior knee. Okay, here are your hamstrings. Okay, you have your semimembranosus here and your semitendinosus. Your biceps femoris here, and these are going to be your gastroc muscles. You also have the plantaris, which also helps to plantar flex or point the toe. That also originates in the back of the knee. And the popliteus, which you don't typically hear a lot about, but that actually attaches, as you can see here, to the lateral femur, if I'm correct. And basically what it does is it attaches down here to the posterior of the tibia and allows for the unlocking of the knee from extension. So you know how you can lock and unlock your knee. This muscle is responsible for helping to unlock the knee and laterally rotates the femur, I believe. Okay, so those are basically the important structures of the knee. So if anyone has any questions about those structures, please let me know. I don't think I'm missing out on anything. We can talk a little bit more about why there are problems with the structures and why we have pain and what we can do to fix those in future videos. But I just wanted to get a nice background and so that everyone understood the structures that I was referring to as I go through this lecture series. So once again, this is Dr. Cameron Dennis, physical therapist for Back on Track Therapy and Wellness. If you have any questions, please feel free to message me, either in the running injury support group or on my Facebook or on my website, which is backontracktherapy.com. So thanks for watching.